Welcome to the European CME Forum podcast. I'm Eugene Pozniak, founder and program director of European CME Forum. European CME Forum is a not-for-profit organisation that promotes multi-channel discussion on matters relating to European and global CME CPD. Its journal is the Journal of CME, or JCME. JCME is a PubMed-indexed, open-access peer-reviewed journal. Earlier this year, we launched the 2026-27 special collection on Future-Ready CPD, Balancing Innovation with Human Connection. In today's episode, we present a conversation between Lisa Sullivan and the guest editors of this special collection, Jann Balmer and Maureen Doyle-Scharff.
Welcome, Maureen and Jann. Great to have you here today to tell us a little bit more about this year's special collection. And before we actually get into the topic and have you guys tell us a bit more, how about I have you both introduce yourselves?
Thanks, Lisa. Glad to be here. My name is Maureen Doyle-Scharff. I have worked in the field of continuing professional development for over 30 years. Recently retired from Pfizer, where I spent the last almost 20 years leading the Global Medical Grants and Partnership Program. I am now working independently as a strategic advisor for a number of different stakeholder entities within the continuing professional development arena, including life sciences companies, specialty societies, academic institutions, and medical education companies. That's me.
That's some history, Mo. Jann, tell us about yourself.
So, hi, I'm Jann Balmer. I am a pediatric nurse by training, but served as the director for continuing medical and continuing professional development at the University of Virginia for 32 years. Prior to that, I practiced my nursing profession, both as a faculty member and as a leader. I've been heavily involved in organizations, both nationally and internationally, and I continue to serve as a strategic advisor and consultant to specialty societies and organizations that are looking for support and guidance and have interesting projects that are fun and exciting. So it's really a whole lot of fun.
Fantastic. So I think our watchers can see that we've got two very experienced ladies managing our special collection this year. So let me just dive straight in. Our topic, or the topic that you guys have chosen, is Future-Ready CPD, Transforming or Balancing Innovation with Human Connection, which is a terrifically catchy title. And I would imagine that can pretty much encompass anything. So how about you give us a bit of an overview of what you were, where you're coming from, what you're really expecting out of this special collection?
Go ahead, Jann. You take it away first, and I'll follow.
Oh, all right. Well, so we understand that particularly in continuing professional development, where we really serve healthcare teams and healthcare professionals throughout the length of their careers, that it's incredibly important that we are relevant to them. And so the need for understanding how technology interfaces with the work that we do is incredibly important. The really important part of this special collection is that we really want to not talk about just AI and what the technology advances are, but really focus on the importance of curated, valuable, highly experienced, knowledgeable healthcare professionals and teams, and how that interfaces and utilizes technology as a partner or as a resource to be able to provide even better care for their patients. And so we can do that through a number of ways. Maureen, do you want to talk a little bit more about some of those?
Yeah,
things?
and I'll just follow on AI. It feels like AI and some of this new technology is just omnipresent in every aspect of life, but certainly within our field of continuing professional development. And so this idea of balancing, as you mentioned, the title of the whole collection, Lisa, with the human connection, we felt was extremely important with respect to the overarching construct of continuing professional development, that AI is not going to solve everything. And I would even say innovation. I mean, we intentionally used the word innovation. We didn't say technology in the title. Innovation can come in a lot of different forms, not necessarily just the latest and greatest technology. Innovation, for instance, in a space near and dear to my heart, and one of our key themes is quality-driven leadership, advancing safe, effective care through strategic change. This idea of change, moving beyond just knowledge acquisition, which is foundational to everything that we do in this space, but recognizing and understanding that we can't just stop there. To just know something is not enough to actually affect change in practice, in a system, and ultimately with respect to patient care and patient impact and outcomes. So we kind of took this very broad. It is intentionally broad, and it's why with this particular collection, we chose to provide some pretty detailed themes to help our potential authors wrap their arms around kind of the areas of focus and interest that we would like to see with this special collection. So yeah, quality-driven leadership, this idea of collaboration, one provider type, one person or one entity is not going to be able to figure this all out. We're really interested in getting submissions that showcase successful collaborations, that showcase how providers have even in small incremental steps, attempted to move beyond knowledge acquisition, by providing tools or other types of resources for our learners, patients, and or a combination of the above. So that's one space or one area of focus. Jann, you want to drill down on another theme?
Yeah, I think I want to follow up a little more on the collaboration piece, because I think the critical thinking skills and, continuing professional development is a relatively young profession. It has been formulated over the last 30 plus years or so, maybe 50 years or so. But the bottom line is that we come in as education and measurement experts, and to really look at how to not only collaborate for our learners, but to collaborate with our peers and our organizations in a way where we become a vital resource that is absolutely essential to moving the needle forward in terms of healthcare efficiency, healthcare effectiveness, really, really looking at how we can maximize the resources that we have in a way that optimizes the success that our healthcare teams have, and that we have in encouraging them and building their curiosity and maintaining their interest, and really getting them to think really actively about what they're doing and how they're doing it, and letting the innovation and the technology leverage, they can leverage those things in a way that saves them time and actually gives them opportunities to be more expansive in their roles.
But I think one of the things that I'm also hearing from both of you is that the submissions that you are hoping to receive certainly don't have to include anything to do with technology, because in essence, a future-ready CPD, although we know that technology will play a role, doesn't necessarily have to be involved, because just collaboration alone in itself, if we did that better and more effectively, we'd be pretty innovative. Am I right there?
Absolutely.
Absolutely.
Another thing, I'll drill down a little bit further and follow on Jann's comments. Again, thinking about innovation, incremental innovation is another way of maybe thinking about this. This idea that healthcare profession education is changing before our eyes. And I don't, sometimes I don't think that the collective really appreciates how quickly it's changing, in that now, I'll go back to my comment on knowledge acquisition. The tradition, what I would call, this is just me, very traditional healthcare professional education on new clinical, new updates, treatment, or, whatever, patient management, something or other. That information is available at individuals' fingertips now.
Mm.
And
Yep.
over the next few months, and certainly over the next couple of years, that how they access those data, and the validity of those data is just going to get better and better and better and better. So another very, very pragmatic, but also innovative concept is thinking about, not training and educating on, the latest, greatest science, but how about training on strategic thinking and communication skills and adaptive leadership? And, we listed some of those in, again, our detailed descriptions of the themes, this idea of being able to synthesize a lot of information. And because, there's so much out there, and that's been true for quite some time now. And yet so much of the education still continues to be very focused on, the like I said, the latest science, the latest data, all important and all foundational. But we would love to see submissions where providers and organizations have really taken maybe a different angle and a different approach to how, in fact, they're educating healthcare professionals, and what are they educating them on?
Yeah, I think the communication piece is an incredibly important piece. Since COVID, workplace environments are not the same as they were. They're probably never going to go back to everyone being in the office or being on site 5 days a week. The whole world has changed. And so the need for innovative communication and collaboration strategies and approaches that actually foster a continuity of care across subspecialties, across institutions, a lot of those kinds of things that can be augmented by technology, but ultimately require human involvement and human decision making and human conversations that are respectful and thoughtful and curious and positive. Because if we can't figure those pieces out, if we can't figure even what everyone used to call soft skills, communication, being nice, being thoughtful to each other, making sure that you're communicating clearly, we're going to be in a world of trouble. And so we really have a great opportunity, and our profession is probably the most best suited to be able to address those kinds of questions, because we are the ones that are really dealing with organizations and how they communicate within there and how their teams work and how you can build capacity. I mean, if we can get them to collaborate well, they can create more capacity. And if they can create more capacity, then everyone receives better care. So, and you can develop more research and you can create new ideas. So it's not just only patient care, but it's research and strategic thinking and organizational restructuring. We're at the point where we're going to have to, all these health systems and everybody else that have built 1 million brick buildings, they're now, a lot of them are empty, and they're having to rethink how they want their organizational infrastructures to work. And we are the right place to really think about how we can effectively transform the healthcare environment through the kinds of things that we're talking about with Future Ready CPD.
Fantastic. Fantastic. So obviously, with the journal being very global these days, how are you guys going with actually putting your editorial team together? Are you looking outside the US? I know the US is probably the most sophisticated market, but are you going to bring others in? Because obviously your editorial team will be the people that review the submissions that you receive. How's that going?
It's going.
Well,
We've identified a number of individuals, and yes, it will definitely be diverse from a geographic standpoint. I guess my thoughts on that too, to your point, this is a global journal. And yes, there's a lot of very innovative things happening within the United States, but Jann and I have both been very fortunate working with you, Lisa, and others, to have worked truly in a global capacity over the course of our careers. And global doesn't mean, well, we built it in the US and now we're just going to go and, dump it in one country or another country. this idea of appreciating and understanding culture and context. Jann touched on capacity building. Sometimes you have to start there before you can expect, truly innovative, change strategies in certain countries, because they're resource starved. They just don't have the experts or the infrastructure that allows them to do some of the things that more advanced countries have. But that doesn't mean that what we're trying to do here is any less important. On the contrary, it's critically important when you think about population health at the end of the day. And it's another reason why you see themes of equity. Whether people think that's something that we should be focused on or not, we felt very strongly that needed to be a part of one of these themes. And this idea of democratizing healthcare professional education, and who is doing that, or who's attempting, and how successful have they been, to a focus on truly global. Again, not just starting, building something and then trying to implement it across the world, but really a truly global strategy that fully appreciates and understands the needs of the learners within the countries and the regions and the local communities where they practice, and where they have very specific, in many cases, patient situations that they are having to deal with. So we're very, very, the idea of global, and making sure that our editorial board brings that experience and that perspective, I think, is vitally important to the success of this collection.
Yeah,
absolutely.
I would agree completely. I think the context in which the CPD system has to function, and there are some countries in Asia who are just now beginning to realize that nurses, for instance, really need to have regular continuing education, or that it needs to be combined with physicians, and they're really beginning to grow the healthcare team in terms of collaboration and those kinds of things. But resources, what the form and structure of the organizations are, what the priorities of the ministries of health in their countries are, all of those things, we need to take those things into account if we're really going to be representative of the global nature of this journal. And so we want to make sure that we have a good representation that exemplifies that in a way that provides us with opportunities to really make sure that as we have people reviewing and reviewing these submissions, that they understand the context in which they're reviewing them, and that it's aligned with something that is reasonable, and that we're giving, if we need feedback, that we're giving reasonable feedback in a way that optimizes the hard work of the authors who are submitting these manuscripts.
Yes.
So
Yes.
it's incredibly important.
Yeah, you're absolutely right, Jann. I think we sometimes lose sight of the enormous amount of work that goes into putting a manuscript together. And for many people, it's not necessarily something that they do in their everyday life. So it's not only challenging, but incredibly time consuming. And we need to show respect when we are reviewing and looking at the work that they've done, put their heart and soul into. So, well, ladies, anything else that you'd like to sort of close with respect to this terrific collection?
We're excited to see what comes in, and we're available to answer questions we have provided some, as Maureen said, some really nice descriptions to try to help provide some guidance. But if there are questions or other things that potential authors, need additional information, I mean, we're certainly available to be able to have those conversations and make sure that we're enhancing and encouraging people to share their stories and their knowledge and their expertise to the fullest benefit of their colleagues and their peers, and that we can make it available so that we can make it available through the journal.
Terrific. So I'd like to thank you both very much for your time. I just want to remind all of our viewers that all of this information is on the jcme.org website. So all the details, all the themes that these ladies have put together for this very detailed special collection that we have this year. Also, contact details for both Mo and Jann are on the website. So please do go to the site, have a good look at it, and we look forward to receiving submissions and for having you both manage this terrific topic that we're going to be covering. Thank you so much for your time.
Thank you so
Thanks,
much.
Lisa.
That was Lisa Sullivan in conversation with Jann Balmer and Maureen Doyle-Scharff, guest editors of the 2026-27 special collection on Future-Ready CPD, Balancing Innovation with Human Connection. As a reminder, the 2025-26 special collection on the value of CME CPD, with Stephen Kufchuk as the guest editor, is still open for submissions. More information about both these special collections can be found at the journal website at jcme.org. Thank you for listening, and join us for more episodes as we explore all things CME CPD.